This is the Spirit of Ecstasy, having a good evening, reviewing medical books, enjoying all these good books. Y'all don't believe I've read all of these, but I have. I've gone through them all, read every bit of it, every bit of them. And they're very, very good. Basic and Clinical Pharmacology, Lang's Current Emergency Medicine, Principles of Neuroscience. There's a good French dictionary put out by Oxford. Textbook of Medical Surgical Nursing, 1 and 2 volume set. Or it comes in a single volume. Principles of Chemistry. This is the one that's the problem solver. Selected Solutions Manual. Essentials of Medicine and Emergency Medicine. And I'm going through real quick, so that I can get them all on there at once. And then I'll come back and review them. Let's see how. Trees and Shrubs, Your Healer Within, Dr. James McGovern and Dr. Renee McGovern. Modern developments in the principles and practices of chiropractic theories. Atlas of General Surgery. Veterinary books, Oxford Textbook of Clinical Nephrology, College of Physics, Textbook of Surgery, Physics, Principles of Physics, Color Atlas of Anatomy, Marriage Textbook of Neurology, Principles of Neurology, Principles of Geriatric Medicine and Gerontology, Veterinary Medicine, Current Therapy, Cons Current Therapy, Pathophysiology, Heart Disease, a Textbook of Cardiovascular Medicine, Surgical Disease of the Pancreas, Merck Manual of Medical Information. That's the home edition, and then I have the other edition over there. That's the medical edition. Mosby's Dictionary. That's the one. That's the Dictionary of Medicine, Nursing, and Health Professionals. Foundation of Osteopathic Medicine, Acute Renal Failure. Up there is pre-hospital emergency pharmacology, neurology, neuroscience, molecular basis of cardiovascular disease, a companion to Brunwald's heart disease, which was this one I just showed you over here. And applied therapeutic. Oh, that's a good book there. I'm going to have to really read that. That's wonderful. Applied therapeutics, clinical use of drugs, gives all side effects and so on by Coda, Campbell, Young, Fradian, Gugel, and Aldridge and Corelli. Gray's Anatomy, Williams and Warwick, 36 British edition. The kidney. Oh, the kidneys are tremendous. Those are volume 1 and volume 2, tremendous. Saunders books on the Brenner and Rector's The Kidney. Goes into detail. I enjoy that study. I enjoy studying the kidney. Concise Gray's Anatomy, Essentials of Nuclear Medicine, Gray's Pocket Anatomy, 26 languages, Concise Dictionary, 26 languages, simultaneous translations, Dictionary of True Etymologies, Dictionary of Languages. I love languages, a definitive reference to more than 400 languages, and then I have the Nancy Caroline's emergency care in the streets, and there's internal medicine. The Human Brain, Introduction to Functional Anatomy, Textbook Medical Surgical Neuroscience, Clinical Anatomy, Hematology, Atlas of Anatomy, Medical Biochemistry, Fundamental Molecular Biology, Functional Neuroanatomy, Russian Bible, Best Choices from the People's Pharmacy, the Neuroanatomy of Man, Calculus, Medical Dictionary, Commerce, Ordinary Ailments, Extraordinary Cures, Advanced Surgical Recall, Handbook of Gastroenterology. That's good. Tabor's Medical Encyclopedia Drugs. Davis's Drug Guide for Nurses, Dictionary of Linguistic Phonetics. There's the Merck Manual. That's so good. Emergency Medicine by Klein and Mall. Diagnostic and Laboratory Test Reference, very good. Mosby's Diagnostic and Laboratory Reference, Text Reference, very good book. Some books in French and German. Andrew Weil, MD, Spontaneous Healing. L. Ron Hubbard, Scientology, Cruden's Complete Course, Old New Testament's Perfect Health. Is this thing on about computers? And get over there to those. Principles of Internal Medicine, cellular and molecular immunology, nervous system, residential races, and there's much more over there that I can't get to. Okay, and then here's a textbook of biochemistry with clinical correlations, immunology, serology, diagnostic microbiology, and then there's a anatomy for students. Let's see if those are all getting in there. Yeah, anatomy for students. That's a very good anatomy. That is just really good. That's great anatomy for students. It has a whole lot of wonderful illustrations in there. That's just marvelous. Illustrations on every page. Intermediate emergency care, Bledsoe, Porter, and Cherry, medical surgical nurse. There's the one volume text. You can see how thick it is of Bruner and Sutter's medical surgical nursing. It's by Smeltzer and Barry. That's the one to have. That's the main go by textbook of nursing for RNs, medical surgical nursing, Lippincott. Mayo Clinic Gastroenterology and Hepatology Board Review, and then there's the good Principles of Internal Medicine by Harrison's. I have a lot of different editions of that. I have some of them that the new ones I got them boxed up so they don't for protection because I just really love them. Casper, Braunwald, Fossey, Husser, Longo, Jameson, and Harrison. McGraw-Hill. More daily clinically oriented anatomy. I love anatomy books, as you can see. I got every anatomy book there is almost. And then a comprehensive review for veterinary technicians. And then there's Williams' textbook of endocrinology, wonderful book on endocrinology. And there's Cotran Community College's Robbins Robbins Pathological Basis of Disease. That's a wonderful book just to read through. Every RN doctor needs to read through that entirely. And we have Robbins Basic Pathology and Clinical Lipidology. That's a very good one there too. That's a companion to also the Brunwald's heart disease. And then there's Clinical Medicine, Kumar and Clark's Clinical Medicine. And then I have some various other books, 1,000 Days on John Kennedy and Persian Fire. It's on the history of the Persian wars back in the BC times. Persian Athens and Persia wars. The history of the House of Representatives, and then those two novels there by Tom Clancy and James A. Michener, which and then, that one's upside down, but that's a defining moment by FDR. It's about the life of FDR, which is very, very, very good. Has some good statements in it. Lang's Current Consult Medicine, very good. McCall-Hill, Health Breakthroughs 2012 and Bottom Line. World Undone about the Great War, about the history of World War I. G.J. Meyer, and then Win the War Within by Floyd H. Chilton, Ph.D., which is a good one about cosmetic medicine and so forth, and the right kind of things to do there. And then there's various other stuff. Ellison's Atlas of Surgery of the Stomach and Duodenum, and Berry's Clinical Advisor, CBI Collection of Digestive System, Minding the Body, Mending the Mind, and various other psychosomatic books up there, too high up for me to see them. With that in front of it, and you can see those. And I've got them all the way to the ceiling and everywhere else. And then this is just one room. I got them in all other rooms, too, all kinds of books. And I've read them all, and they're all very good. Oh, there's a whole stack of them over here that I won't have time to get those over there on the other side. I got that many more over there on the other side. I got. This is good for me to do because then I remember what I got. I forgot I even had that. About half of them forgot I had. And then this one here is a, okay, I want to really review this here. Good. You'll get these. This is this Merck manual, which is just a marvelous book. I mean, it's just marvelous. I mean, you can read that through and you just cover that. You cover the whole medical field, and of course you have to go back and get details out of other textbooks, but it gives you a general overview and survey of the entire medical field in here and all the drugs and everything. American Manual of Diagnosis and Therapy by Robert Burkall, MD, Editor-in-Chief, Andrew J. Fletcher, MB, and then here's a bunch of all the editorial board, and published by Merck Research Laboratories, Division of Merck and Company, and so on. And there's a lot of newer versions. You can get one that come out about every year, newer versions. But this has all the basic information, and you get a few new things in the newer books. And here's the contents here. Guide for readers, abbreviations, symbols, editorial board, consultants, contributors, infectious diseases, immunology, allergic disorders, cardiovascular disorders, pulmonary disorders, gastrointestinal disorders, hepatic and biliary disorders, nutritional and metabolic disorders, endocrine disorders, hematology, and oncology. And they do cover those subjects too. It covers it. Musculoskeletal and connective tissue disorders, neurological disorders, psychiatric disorders, genitourinary disorders, gynecology and obstetrics, pediatrics and genetics, otolaryngology, ophthalmological disorders, dermatologic disorders, dental and oral disorders, disorders due to physical agents, special agents, clinical pharmacology, poisoning, venomous bites and stings, and index. And it's just a marvelous book. And I've read through the whole thing and several times, and it just really does cover it. You have your abbreviations and symbols here in the front, that's an education in itself. And learning you can learn all these symbols, and I love acronyms anyway. And it gives you all those. G6PD is a good one to memorize. Glucose 6-phosphate dehydrogenase, and EU for genital urinary, and so on and so forth. It's just marvelous. And nice pages. Here's the other rest of it. See if I can get a good picture of that. Okay. And here you just have, it's full of this, what's really good is it's just packed full of these kind of charts like this. There's lots of illustrations in it. There's lots of just reading too, just black and white letters, but then there's a lot of charts like this too that are very, very, very helpful. And see, and then here's how they break it all down good, really good. That's what's so good about it. And it's the same in each one. Pseudomonas infections, and then they give you the epidemiology and the symptoms and signs, and then everything it covers, it gives you all that same symptoms and signs, epidemiology, and the side effects. And everything's all broken down. The treatment, and it gives you the treatment for each particular thing. Is on down further, you get the treatment for it. What the recognized treatment is for it, and it just covers everything, ever known disease and problem, Clostridial uterine infection, and so forth. Okay, and we'll continue on the next video.